Good afternoon. I'm Ingolf Ernest of PS Health, and I welcome you to this webinar, Quantifying the Benefits of Mobile Care Delivery. And I'm here with my colleague, Rob McGovern.
Yeah, good afternoon, everybody. Nice to see so many attendees here today. My name is Rob McGovern, Director of National Accounts of PS Health, and I'll be keeping my eye on any questions that are fielded to Ingolf during the session. So please feel free to email questions in and I'll field them on your behalf. And I'll come back to Ingolf.
That's great. Thank you, Rob. Well, let's quickly look at the agenda. So we are quick through introductions, then we will talk about mobile care delivery and really what it is. Look at the quantifying the benefits, of course, which is really the reason why we're here, and then wrapping up. And as Rob said, please do field questions. On the panel to your right, you could add your questions. We're very keen to make this as interactive as possible. Just before we kick off, I wanted to draw your attention to our next webinar, actually. On October the 16th at 3:30, we are really privileged to have Andrew Osborne. He is head of adult social care in Wiltshire, where, as you probably have heard, they've been running a series of pilots or experimenting with outcomes-based commissioning, and probably the local authority in the country that's the furthest down that path. And Andrew will be talking about the impact on providers of this move towards outcomes-based commissioning. So very exciting. You can find the details on our website, pshealth.co.uk, and then there's a tab for PS Insights, or my guess is you can search PS Health and Wiltshire on Google and the webinar should come up. And feel free also to pass that on to colleagues. Very good. Well, let's look at mobile care delivery and what it is. I guess, as you would expect, this is partly about nurses and care workers in the field using mobile phones. The smartphone, as we all know, has gotten cheaper, more powerful, and we believe that it can help take care to the next level. Having said that, I'm not sure if mobile care delivery is actually the right term, because if we look at the whole ecosystem here, this is really about connecting all the stakeholders. So from the nurses and care workers in the field, via people are responsible for the clinical governance, operations director, all the way through allowing commissioners and next of kin access to data and in portal viewing the delivery of care. So that's when we talk about mobile care delivery. We're thinking about that whole ecosystem. In terms of just getting down a little bit deeper, we believe that this mobile care delivery, the important aspect here is really to allow both people in the office and staff in the field to have access to the full case. So on the one hand, we're talking about time and attendance or electronic call monitoring, checking in and checking out with NFC tags to track time of care delivery. But equally important, or maybe more important, are the case management capabilities, so access to care plans, assessments, document management, outcome tracking. And that really is the kind of the umbrella of the functionality under mobile care delivery. In terms of benefits, we believe, we're going to talk today about quantifying the benefits, but obviously there are a whole number of intangible benefits. We just want to have a quick look at that. So we believe it can help deliver safer care. This is mostly related to full visibility, right? So people in the office can see when visits are late or potentially missed. We can track actual compliance with care plan, get confirmation that medication has been given, etc., etc. In terms of safety, there's also a lone worker protection aspect here, in that being in touch with your staff, you're much better able to look after their safety and well-being. Perfect. In terms of better, what do we mean? Well, fundamentally, this is about delivering better outcomes. We believe better outcomes comes partly through delivery of a consistent service, consistent use of forms, ability to document outcomes. So if you run a re-enablement service, you obviously have to be able to document the outcomes of that service. And then lastly, is more profitable. and we'll go on to look at that right now. So in terms of quantifying the benefits, what we have done is we have developed a mobile assessment process, and it's really a, it's a framework that looks at various aspects of your business and trying to document or evidence the benefits, the quantifiable benefits in each of those segments of your business. Now, of course, on this webinar, we have a bit of a challenge in that we have a large number of people listening that come from that are, each working for different type of businesses. Anyhow, Rob, I can see you wanted a question had come in.
It's a question I get often asked, Ingolf, in my conversations with the home care providers. How do you deal with the breadth of operating models out there, from the traditional kind of home care companies to the more complex, or tends to be more complex, NHS-funded care?
Yeah, look, it's a great question, and I guess as it comes to assessing the benefits, as one size does not fit all. I mean, the fundamental question is really, how are you paid, and how are you paying your staff? I mean, what we do with some of our customers or potential customers or interested party is deliver a half-day assessment where we really try to go into that and use very relevant benchmarks. In this presentation, we're going to go through we're going to give you an insight into that, but obviously an actual assessment would have to be tailored to the specific organization. In terms of the key buckets of savings, let's look at those quickly. Number one is protecting and increasing revenue. Number two is looking at reducing your operating costs, and that operating cost typically falls into frontline staff, cost of care coordination, and then also costs associated with invoicing and reporting. And the last bucket that we typically look at is the balance sheet impact. So this looks at reduction in debtor days.
Okay, just pause you there, Ingolf. I've just got a question come in. Regarding savings, are there any rules of thumb out there, any kind of indicative views that you have?
Well, we've done a fair bit of work for different organizations here, and I guess we've seen a number of times that if you run, say, a 500-person organization, I'm thinking about 500 people in the field, you should be looking at savings of 150 to 250,000 pounds a year, and that's after the cost of the actual mobile and line connection, etc., etc. Let's, in the next few cases, we're going to look at some specific ones. So let's jump into that, shall we? So in terms of looking at protecting and increasing revenue, here's an example where Commissioner comes out, asks a range of providers to show how they would demonstrate outcomes and care plan adherence. So these are slightly more complex cases, and what happened here is Commissioner also went through quite a dramatic reduction in the number of suppliers to the contract. The quid pro quo, if you like, was getting access to referral volumes or some level of guaranteed volumes, and then there was also a bonus scheme associated with achieving the underlying outcomes. And in this case, you look at a customer who I think had revenues grew about 18% across 2 branches for this particular point. Rob, you were saying?
Yeah, I've got a question here. Absolute reduction in supplies, totally agree. I'm seeing that nationwide in my conversations and visits to home care providers. But really, on the commissioners, are they really continuing to commission the same old service? Is it more rhetoric?
Look, I'm smiling because it's a good question, and I think we all agree commissioners are now, and have over the last, I think, 24 months, suddenly started to reduce the number of providers quite dramatically. Many of those reductions are done in the context of more accurate tracking of outcomes, but I think it's fair to say that there's still quite a lot of talk and not that much action. But if the progression of the last 24 months is anything to go by, we expect to see commissioners getting more clearer and clearer on the definition of these outcomes. In terms of next step, looks at frontline staff and the savings. Once again, example here looks at complex care frequent comprehensive assessments on the front line. I think this was CHC's continuing healthcare, NHS funded care. By introducing mobile care delivery, we were able to obviously remove paper, standardize assessments, reduce travel time, and also this crazy thing about traveling back to the office to rekey information that was captured on paper. The upshot of this was that I think that this particular organization called their staff case managers, so the case manager in this case increased their contact time, so that's the time spent in front of a patient or service user by 30%. So pretty significant. And because of the mix between support worker and case managers, actually the total people cost went down with 5%. Rob, I can see.
Yeah, two questions in golf. One myself, one from one of the attendees. Classic question regarding frontline staff: what changes to process and training are required? It's hard just seeing given a tablet or a smartphone and they get it to work. So what's the views there? And the second question then, so what we are saying then is no savings if we're not paying for travel time. What's the view there?
I'll take the travel time first, because I think even there's been a number of organizations in this country that have not been paying for travel time, and in the extreme you're right that you may not generate a benefit. However, I guess we are now once again seeing, and this is partly linked to the issues around pay, is that providers are being gradually forced to start looking at paying for travel time. So, once again, if you look 24 months forward, I think the more efficient use of frontline staff is critical. Also, it's something you owe to your staff, because having the staff run around zigzag it's a waste. It's not valuable time for staff. In terms of processes and changes required and training required, I think that's interesting. I mean, ultimately, we feel that the biggest benefit here is from standardization of processes, getting real-time management information, because when you do those two things, you can really start comparing productivity of staff members. And, that's when people say, oh, we could do this a little bit differently, or there's a smarter way to do this. Okay, very good. Next point looks at care coordination. So this is the role inside, the back office, if you like, or the people who are helping make sure that care is delivered on time. Deploying mobile here, a couple of key benefits is traditionally either send out by paper, obviously a number of costs associated with that, but the benefit of mobile care delivery is really being able to deliver this right to mobile. So not only do you save the paper and the logistics around that, you're also able to constantly update the rota. So that means that it's easy to make in-day changes. When I've been on the road seeing care workers with a whole stack of sort of the rota, some information on service user, etc., it all becomes quite messy towards the end of the week if you're, for example, planning on a weekly schedule.
Okay. A lot of talk about rotas and rostering here. What savings, if any, are you assuming in here?
Well, you'll see this. I think we looked at reducing the cost associated with care coordination by nearly 30%. Now, these numbers actually don't take into benefit the actual rostering process. So the assumption here is you have or you're using a rostering process. What we're really doing is deploying that to mobile. Another thing to pick up here, which is also very intrinsically linked to safety, is this idea of alerts for late visits. So obviously in a mobile care delivery world, the nurse or the care worker can swipe in and swipe out, and you've got very good visibility of where they are. That allows you then to escalate alerts if a visit is late, for example.
Key issue I do know in the market, I get asked this quite a lot in my conversations. What's your view on buying phones for staff or supplying them?
Yeah, look, that's another great question, and I guess there are exactly those two camps. The benefit of buying phones for your staff is obviously you control the process better, you can lock down the device, but obviously there's a cost associated with it. So the other side is so-called bring your own device, which potentially is significantly cheaper, but it doesn't have the benefits of locking down the phone. in terms of case D, looking at invoicing and reports, so the scenario here is with mobile care delivery, nurse or care workers can check in and check out, so that's swiping in and swiping out when the person is in the individual's home. There's a form to track deviation, so if you are late or you've been staying longer because maybe you had to wait for the ambulance, you can recover all that information. Also includes integrated reporting, and obviously the biggest upshot of this is really a dramatic fall in challenged invoices. So if we look at that, we're looking at the cost of invoice management and reports. In this particular case was down by 37%. Rob, you were saying?
Yes. How do you deal with the challenge of mandated systems such as CM2000s that are mandated by local authorities?
Look, I think it can be a challenge. I guess our advice is providers should be pushing local authorities hard on this point, and it's not a technical issue. It's really a contractual issue. I guess also we're seeing that more and more councils are moving towards, I think, what they call delegated call monitoring. In other words, where they're in essence they're defining the data set they want, but not necessarily the provider.
Question from one of the attendees here: is NFC the right technology?
Well,
what other options are there?
Yeah, no, once again, a great question. I think the NFC we think is the right technology. I mean, the alternatives is GPS, but the accuracy of that is not as great. QR codes would be another one. We've now in London seen a number of examples where councils in particular are insisting on using NFC as the sort of the most tamper-proof solution. Great. Last bit is looking at the balance sheet impact, and this is really about, and you could argue this is a function of improving the invoicing process and the data related to service delivery. So in KC, working with an organization, we reduced the challenged invoices by nearly 60%. So what did that mean? Well, it meant that accounts receivables went down from 400 to 200,000 pounds, and the amount of bad debt, if you like, of service that had to be written off was reduced by over 40%. I think this point is very important for all deliverers of health and care in a home, because you deliver a service, you may pay your staff on a weekly basis, and if you then get stuck with challenged invoices, it really bloats your balance sheet. And I think in this case, debtor days went from 40 to 22 days.
I know invoice reconciliation is a huge challenge for finance team, but I mean, what do you do when it's outward against the commissioner?
Well, I mean, you're never 100% protected, but better data management that is really at the core of this, and making sure that commissioners have faith in your data is I think the only way forward, isn't it? That's great. We're coming towards the end. I wanted to just wrap up. So mobile care delivery, we believe, will help you deliver a safer service. I mean, this is about full visibility, being able to track compliance to care plans, track missed visits, track medication given, etc., and the lone worker component. We think it delivers better care because you can better deliver outcomes by having a consistent service, by documenting. You can go back to commissioners, improve your outcomes. And lastly, as we said, we think it can be significant. It can add significantly to your profitability. So with that in mind, if you are interested in discussing a free mobile assessment with us, please get in touch. On our website, you'll find all the details, and on our telephone number 0845 50 50 120. Just mention that the recording will be available on our website in about a week's time. And don't forget to sign up for our Wiltshire webinar on October the 16th. Thank you very much. Bye-bye.